If you take a pill every morning for your blood pressure, I want you to listen carefully to the next 2 minutes. Not because something is wrong, but because there's something many doctors don't have time to explain, and most patients never think to ask. You take your pill, you trust it, you move on with your day, and that's exactly how it should work. But here's what so many people don't realize until years later. There are a few simple questions, the right questions, that can completely change how well your treatment works for you. Not a different medicine, not something to be afraid of, just a better conversation. Today, I'm going to walk you through exactly what those questions are, why they matter so much, and why asking them could make your day to day life feel noticeably better. Many people are surprised they never thought to ask before, but now the main thing begins. Stay with me, because by the end of this, you'll know exactly what to bring up at your next appointment and why it matters more than you think. Let's start with something simple but very important. Most people think of their blood pressure pill the same way they think of putting on their seatbelt. You do it because you're told to, you trust it works, and you don't think about it much beyond that. And for many years, that's perfectly fine. The medicine does its job quietly in the background. But here's something worth understanding. Blood pressure isn't just one number that goes up or down, it's connected to how you feel throughout your entire day. Your energy in the morning, how steady you feel when you stand up, how well you sleep at night, even how your legs feel after a long walk. This is very important because so many people experience small changes in how they feel and never connect it back to their treatment at all. They just think, well, I'm getting older. This is normal now. Sometimes that's true, man, but sometimes it's something worth a 5 minute conversation with your doctor. Here's why this matters so much. Blood pressure treatment isn't meant to be set once and forget forever. Your body changes. The seasons change. Your activity level changes. What worked perfectly for you 3 years ago might need a small adjustment today, not because anything went wrong, but because you're not the same person you were 3 years ago. Nobody is. Many people don't even realize this is normal and expected, not a sign of failure. This is where so many people make a quiet, understandable mistake. They assume that if they're not in pain and nothing dramatic is happening, then everything must be fine exactly as it is. And often, it is fine. But fine and as good as it could be are not always the same thing. The reason this matters is much more important than it seems at first. Small ongoing conversations with your doctor, even when you feel okay, are often the difference between just managing your health and actually feeling your best. I want you to feel understood here, not lectured. You are not doing anything wrong by simply taking your medicine and going about your life. That's exactly what most people do, and it's reasonable. But there is a small layer of awareness that, once you have it, you'll wonder why nobody mentioned it to you sooner. So, in the next part, I'm going to give you the actual questions. Specific, simple, easy to remember, the kind you can jot down on a sticky note and bring to your next appointment. Nothing complicated, nothing that requires medical training. Just a short list that helps you walk into that appointment feeling prepared instead of just present. Stay with me, because this next part is where things become genuinely useful. All right, let's get into the actual questions. I want you to imagine writing these down, maybe on a small piece of paper, and bringing them to your next visit. You don't need to memorize anything, you just need to ask. Question 1. Is this still the right dose for me, given how my life looks today? This one sounds simple, but it opens an important door. Doctors often set a dose based on where you were when you started treatment. But maybe you've lost a little weight since then. Maybe you walk more now or less. Maybe your diet has changed, or you've cut back on salt without even realizing how much that matters. All of these things can shift how your body responds to the same dose you've been taking for years. Asking this question simply gives your doctor permission to look at the full picture again, instead of just renewing a prescription out of habit. Question 2. Are there any habits at home that could be working against my treatment without me realizing it? This is very important because so much happens in daily life that nobody connects back to blood pressure. The amount of salt in everyday foods, how much water you're drinking, whether you're sitting for long stretches without moving, even how well you're sleeping at night. None of this is about doing something wrong. It's about small, invisible patterns that quietly add up over months and years. Many people are surprised how much a few small home adjustments can support what their medicine is already doing for them. Question 3. Should I be tracking anything at home between visits? A simple home blood pressure monitor, used a couple of times a week, can give your doctor something incredibly valuable. A fuller picture instead of just one single reading taken in a stressful waiting room. Many people don't realize that the numbers at the doctor's office don't always tell the whole story. What your body does in the comfort of your own home, in your own chair, after your own morning routine, that tells a different, often more accurate story. Question 4. Could any of my other medications or supplements be interacting with this one? This is a gentle but important one. As we get a little older, many of us end up taking more than one medication. Sometimes a vitamin here, something for sleep there, maybe something for joint discomfort. None of this is unusual, but it's worth a simple check-in, just so everything is working together properly rather than quietly working against each other. Notice something about all 4 of these questions. None of them are scary. None of them suggest something is broken or dangerous. They are simply tools, small, respectful ways of making sure your treatment is keeping up with you instead of staying frozen in time from the day it was first prescribed. This is the part where many people tell me they felt a genuine sense of relief. Not because anything dramatic changed, but because they finally felt like an active partner in their own care, instead of just a passenger. But there's one more piece to this, something that ties everything together and helps you walk away from this video with real clarity. That's exactly what we'll cover next. Here's the real heart of everything we've talked about today. Your blood pressure pill is doing important, quiet work every single day. That hasn't changed. What we're talking about isn't replacing that, doubting that, or being afraid of that. It's about something much simpler and much more powerful. Staying an active, informed partner in your own care, year after year, instead of letting things run on autopilot forever. Think of it this way. A good treatment plan isn't a statue. It's not something you set once and leave untouched for the next 20 years. It's more like a garden. It needs a little attention now and then. Not because something went wrong, but because that's simply what keeps anything healthy and thriving over time. The people who feel best year after year aren't the ones who never ask questions. They're the ones who check in, gently and consistently, and make small adjustments along the way. So here's what I want you to take from this. You don't need to feel worried. You don't need to feel like you missed something important. Most people have never been told any of this, simply because doctors are busy and appointments move fast. Now you know. And knowing is the first step. Before your next appointment, take 30 seconds and write down those 4 questions we covered. Keep it simple. You're not walking in with suspicion. You're walking in with care for yourself, and that's something to feel good about, not anxious about. And if this video helped you feel even a little more confident, a little more prepared, that genuinely makes me happy. That's exactly why I make these videos. Not to alarm anyone, but to help you feel like you're truly understood and truly cared for when it comes to your health. Take care of yourself, ask the questions, and I'll see you in the next video.